once again, good afternoon and welcome to this panel section. Please, I know some of us probably have one or two questions that we want to ask. Please, let's note our questions. During the plenary section, we'll be taking the questions. Yes. So this afternoon, we have listened to the presentation, the findings and recommendations from the policy analysis of health taxes. So we'll be inviting some panelists to share insights and additional things that will enrich the conversation, so that at the end of the day, we have a richer report to present. Like I said, part of what we're trying to achieve is to have a very strong and broad-based coalition starting from this conversation. So that reflects in the composition of the panels. So we have our policymakers from the Federal Ministry of Health, from the Directorate of Food and Drug Services. We have Mr. Yakubu, the Deputy Director here, representing the Director of Pharmacies, Olubunmi Aribina. Let's appreciate him, please. From the lawmakers, we have the representative of the Chair Senate Committee on Health, somebody that is very, very passionate to ensure that we have a robust legal framework for health taxes in Nigeria. So she's represented by Professor Chima Onoka, who is the technical advisor to Chair Senate Committee on Health. Professor, come over, please. And then, the Federal Inland Revenue Service, these are the part of agencies that probably we've not been interacting with often, but they have very, very important role to play when it comes to implementation of various SIS legal framework. So I have the pleasure of introducing Mr. Matthew Oshakwe, the Deputy Director, Tax Policy, Federal Inland Revenue Service. Then we have from the Nigerian Tobacco Control Alliance, Mr. Chibuke Nwokore. Please join us in the, thank you very much. Then there's an organization here that have done very, very well in terms of conducting fiscal space analysis. How much are we going to get from these health taxes? If we are talking about earmarking, which one should we prioritize? So we have Dr. Bolanle Olusola Fale, Chief of Party, USAID LHSS. And all the way from the DC, joining us virtually today is Daniel Bloom from the Global Tax Program Health Taxes, World Bank from DC. Can we confirm if Daniel Bloom is there?
I'm here, thanks.
Okay, thank you very much, Daniel Bloom. Because it's still very early in the morning in the DC, and Daniel has to go to the office. Let's please start from her. Daniel, thank you very much. You've done a lot of analysis about earmarking health taxes. You've done look at all the countries that have started it, what they have done well, what are the issues, and what are your recommendations or considerations for Nigeria? Because the stakeholders here, you've listened to the presentation, they are very desirous of having health taxes earmarked for health. Over to you, Daniel.
Excellent. Thank you so much. It's a pleasure to be here and be able to speak to you all today. So as you know, the debate around earmarking of health taxes for the health sector is gaining traction, and in part due to the special nature of health taxes as linked to health-related internalities and externalities, as the presentation made just now made these excellent points, as well as their revenue-raising potential. So health taxes, we know, can generate significant revenue when they're well-designed and implemented. Tobacco, we estimate, is around 0.6% of GDP on average, and alcohol, 0.3% of GDP on average. But we also know that health taxes can improve population health, reducing costs to the public and individuals without earmarking. So many of you, as we've been talking about today, are familiar with the term earmarking, which means dedicating all or a portion of revenue from a specific source and formally setting it aside through specific legislation or changes to the tax law. However, we also know that while earmarking is used in many countries, the process can be polarizing and is not a best fiscal practice. Ministries of finance don't like it. It raises issues around distortion, rigidities, additionality. So how can we really approach this topic in a pragmatic way? So where I work at the bank, we've begun to do some work on unpacking more deeply country experiences with earmarking, and what they have learned in terms of the public financial management capacities needed, the existing fiscal capacities. And what we've seen is a broader set of practices that we're putting under the umbrella of the term revenue use. So these are different mechanisms that can help direct revenue towards expenditure purposes outside of earmarking. So while earmarking, hard and soft, fit in this taxonomy, and I'm going to explain what it is in a moment, we've seen that there's countries that can use these types of mechanisms outside of a formal earmark. So I'm going to explain the taxonomy and then some of the country experiences. So first, we like to think about revenue use or the process of earmarking as a process. So one that begins by starting with a policy priority that you're defining, and then determining the mechanism that's most effective to channel resources towards that priority given your country context. So when we look at policy priorities, there's generally 3 levels of priorities that people earmark or direct revenue towards when we look at global experience. So they're high-level sectoral priorities like UHC, programmatic priorities, or those that are targeted at specific population groups. In the context of health taxes, the policy priority can also be compensatory policy, which is something that's meant to offset the impact of the health tax on specific population groups, or it can be a policy that reinforces the consumption benefits of the health tax. So for instance, something that helps to put in place a cessation program. So then once this policy priority is determined at the country level, we then look at what the best revenue use mechanism is to channel these resources towards the country's specific policy priority. And that depends on the fiscal context, if there's earmarking already, if there's political will. These mechanisms that are within the budget that can be used to direct revenue towards expenditure priorities. We know that health taxes can have benefits already for the health sector by reducing consumption of harmful products, by thus creating efficiency gains for the health sector. But there's also simpler mechanisms such as budget advocacy that can be used to increase the size of the health budget towards a specific expenditure priority without earmarking.
I think we lost Daniel there. Probably we'll come back to Daniel when the technology is more favorable. So let's come to Mr. Yakubu, Department of Food and Drugs, which is the custodians of food and drugs that we take in Nigeria at the policy level anyway. So you've listened to the presentation. There are a lot of issues with assessing the data. I don't know whether even the data set is there in terms of volumes of this product that we consume in Nigeria. Can you shed more light in terms of how do we improve the situation? How can we have access to data, baseline data we need for monitoring to know if we are making progress with these health taxes with regards to the commodities? Over to you.
Okay, so thank you very much. And I think can you hear me? I'm not sure is it okay? Okay, so the reality is that data is very, very crucial to any, informed decision that the government need to make, and also, generally industry players, whatever you are doing, if there is no sufficient data, then it means you are not operating based on evidence. And so we have to place a lot of priority to data generation, where of course how we access this data. So in our opinion at the Food and Drug Services Department, of course, which is the which oversights the NAFDAC, that's the National Agency for Food and Drug Administration and Control. And of course, you know that in terms of issuing licenses and so on and so forth, these are all coordinated by NAFDAC. Our opinion is that, you know, as a country, we just have to leverage technology. There has to be a very robust data collection system, you know, in our country that takes into account, you know, manufacturers, importers, distributors, and those who sell these products. There has to be a very robust system that is electronically driven. And of course, this means therefore that agencies such as the Nigeria Customs Service and of course the National Bureau of Statistics and of course even the Federal Ministry of Finance, which of course oversees the Nigerian Customs Service, have to up their game and ensure that you know they are digitally savvy and such that whatever information we need in terms of the importation, in terms of the manufacture, in terms of in terms of the sale, distribution of these commodities, you can readily access them. We also have to, you know, develop a very formidable tracking system, you know, of these commodities that we are talking about. In other words, whether it is alcohol or it is tobacco, or you're talking about the SSBs, there has to be a tracking system, again, that is digitally, you know, driven, and, you know, so that with a click, you are able to get information as to, you know, how much of it is coming, how much tax is being generated. And of course, then you are able to make a very strong advocacy, whether it is to the National Assembly or it is to the executive, you know, as to how you feel that some of these taxes can be used to, you know, support and strengthen the healthcare system. We also have to look at other issues, you know, like, you know, constant monitoring. There has to be a constant monitoring of data collection tools, you know, and evaluating them to ensure that, you know, they meet, you know, the modern trends and things like that. I believe that, you know, agencies of government have to come together, have to collaborate, you know, they have to work hand in hand and ensure that these data are not too secretive. Of course, if you talk about data privacy policies, it's also security and privacy policy. It has to also be very, very robust. But I think the most important thing here that I'm trying to pass across is the fact that for us, technology has to be leveraged at this point for us to be able to have a very robust data, you know, access to data as it pertains these products, alcohol.
Oh, okay. Thank you very much, Mr. Yakubu. I think that is very, very clear. Later on, I'll come back to you in terms of those areas, technology and other things you identify. What support does your department need? Because we have implementing partners here and others that can work with you to overcome those challenges. So let's go to the Federal Inland Revenue, the money man. Thank you very much for coming. I don't usually have interaction with the Federal Inland Revenue Service. So Federal Inland Revenue Service has a responsibility of implementing whatever SIs that we put in place. So want to know how the Federal Inland Revenue Service works. How do you do this? And then what challenges do you face? How do we work together to overcome some of those challenges, Mr. Osinokwe?
Yeah, thank you very much for inviting FRS. So greetings from the good chairman, Dr. Zach Adedeji. Let me just lay this background. Federal Inland Revenue Service has the mandate to assess, to collect, to account, and enforce taxes that are listed in first schedule of the FRS Establishment Act. Excise is not listed as we speak. And I'm also actually very surprised that in this room, I expect to see Nigerian Customs, because that is their beat. They collect excise. They collect customs duties and excise duties for the Federation. So FRS don't collect excise duties. So I want to place that on record. Also, I want to also place on record that I also expect to see in this room the reps from the Federal Ministry of Finance, because Ministry of Finance superintend over Nigerian Customs. And every year, that's what they call the Fiscal Policy Measure, FPM, Fiscal Policy Measure, that is being rolled out by the Federal Minister of Finance. So that Fiscal Policy Measure actually spelled out tariff system, excise, in terms of national list, and in terms of prohibition list, in terms of the tariff to be added, in terms of adjustment in your excise duty. So like we saw last year that the president have to reverse the fiscal policy measure. So I want to actually place that on record that Federal Inland Revenue Service do not, as we speak, collect excise. But what do? We support the policy formulation. So FRA is a member of the Tariff Technical Committee that is set up by the federal government that look at the issue of tariff, which has excise also embedded in that framework. If you look at the fiscal policy measures that were actually rolled out, they are actually fixed, like from the presentation that was made, what we call the specific rate and the ad valorem. So there is this effort by the Tariff Technical Committee to begin to have an overview and begin to key in into the global air tax framework. So what they try to do is to begin to make a move to increase the rate, for the SSB and the alcoholic. We have levels. The SSB rate is fixed at 10 naira as we speak. Then we have the alcoholic beverages, also have the tobacco. So rate, we have the ad valorem, also have the specific. So we can share that data. But basically, FRS support the implementation of what other countries call syntax to ensure that that is rolled out to reduce the consumption and of the other end to increase revenue. But majorly is to see how that policy can actually reduce the consumption, because from statistics, you can see that the rate of obesity, the rates of diabetes, cancer, and all that is increasing. So there is need for comprehensive, all-inclusive framework in this regard. Now, another thing I also want to mention about issue of marking taxes that is collected. It is a constitutional matter. The Constitution rightly says, as you speak in Nigeria now, that all taxes are collected, and accrued to the federation account. And that tax is not shared between the federal, between the state, and the local government. So you can't say, I want to mark taxes collected from sugar, from alcohol and beverages for each sector. But basically, if you look at the trajectory of the budget over time, 2020 over 500 billion was the mark for that sector. It moved to about 800 billion in 2021. It moves to about 1.1 trillion in 2022. It moves about 1.1 trillion in 2023. Then the last year budget is about 1.5 trillion was a mark for X sector. You can see the increase in its trajectory. So for you to have for you to begin to mark taxes collected is a fundamental constitutional matter. Now, I want to also state that during the committee, it's an all-inclusive committee that we invite stakeholders. Man is a member of that committee, sir. And when we are discussing about increasing the excise for, issue of health, because it requires political will. For instance, it was increased in the PMF last year, but it was reversed. Why was it reversed? Because the players in the the players in the manufacturing sector gave Mr. President a statistics in their own wisdom that if you increase the excise tax, a lot of things, the value of, because excise tax is actually imposed on manufactured product at the point of manufacturing. Okay, so if you increase the excise tax, it will increase the cost of production. So, and the cost of the product will increase, consumption will reduce, it will lead to unemployment and all those statistics. So that was, so it requires every one of us to agree. You want to go this trajectory, you want to go this way. And so basically FRS as an organization, as we speak, do not collect excise tax, but actually involve in formulation of policies. And also want to state that Minister of Trade, Industry and Investment is another, is the mother agency that drives trade facilitation Nigeria. So when you bring their statistics to the table, say, oh, increase tax, issue of increasing of tax, and the correlation between increase in tax, excise tax, health tax, and manufactured products. So there is need for government concerted effort to put its stand and say this is the way to go. So it requires political will, and also there is need for us to begin as a government to begin to have one voice. What I call, you have been having issue of policy somersault. You see a policy driving towards this direction, and a policy driving towards another direction. But I'm glad that Mr. President, in his wisdom, has set up a presidential fiscal and tax reform committee. That committee is looking into that direction. So Mr. President is taking it easy and also has made a very giant step by setting up that committee to have an overview of fiscal policy measures. And I'm glad that very soon the report. So I want to also state that you as a stakeholder, get in touch with the committee, and this issue will be looked at. And at the end of the day, when the policy outcome begin to receive policy outcomes, every one of us will smile in Nigeria. Thank you very much.
So thank you very much. I think that is very, very helpful. We are very happy to know that your role, we are even more interested in that role because you have a say in terms of setting these policy rates and everything. That could even be more important than collection. I mean, exactly. Yeah, so interaction with Taiwo Oyedele, the fiscal reform committee. He has his own argument, but we're trying as much as possible to counter some of these arguments. But thank you very much. I'm happy you are not part of our coalition now, so you'll be helping us providing that information. Let me go to the National Assembly. Professor Chima Onoka. Whatever the legal framework, before it is finalized, before it becomes law, the lawmakers have very, very important role to play. And we have seen a situation where a bill spent like 10 years in the National Assembly before it is finalized. You are the one advising the lawmakers now. Your advice is what they follow. So, Professor Chima, how do we ensure that we have the best of support from the National Assembly when it comes to enacting health tax related legal framework? Prof.
Thank you very much, and appreciations from Senator Banigo, who asked me to sit in here for her as well to present her. I think the feedback from the study, is quite instructive, and it's still connected to your question. But at the end of the day, I think there's a realization that the people at the National Assembly are also representatives of the people, or are supposed to be representatives of the people. And the feedback showed clearly things about the design, like you mentioned as well, but also whatever is the outcome of any policy design it's a reflection of the level of acceptability of that idea. Whether it's watered down, whether it's very strong, it basically reflects how much it has been accepted or not. So beyond, there will be all the technical arguments, and I know that we have enough. Even at that, there are still issues that may emerge. I mean, Nigeria, people can talk about, especially for the SSBs now, and linked to obesity and the related diseases. Nigeria is somewhere around 153 in terms of ranking, which is about 8-point-something% in terms of prevalence. Unlike the US, that is 10th globally and 40-something% prevalence of obesity. You will still have challenges with pushing for such policies in the society where you cannot clearly push a lot of things related to obesity as being driven by SSBs. It's an issue. When you have that, even when the bureaucrats and those at the policy level and policy making level raise the arguments for financial resources that can be, mobilized for political side. I think this is okay. It's back. It's not the fiber optic cable now. So they're still going to weigh the other things, and truly, people will think, especially in our country now, that I think the elasticity for when people hear tax today, we know what it means. We know what is going on at the moment. It is the reality, and when you have that, even those, and especially those in the National Assembly who consider themselves as representatives of the people, will think twice whether there is political capital or there is something negative they'll be attracting to themselves by engaging with that conversation. It's a reality. We can't run away from it. So, but they are all the things that we need to consider. And quite frankly, I mean, I'll say, if we look at that, even the technical part, somebody will think about the citizens, even when you look at it from, fine. To what extent does a sugar one, what would be the concentration in terms of resource mobilization? Is it the wealthier? Is it the poorer people in the society that will be affected? The political people will think about it before standing in front of the chamber, before standing in front of everybody to be publicized as being the ones to drive that kind of agenda. If you're going to capture, there's no SSB, there's no sugar beverage on our tables here. Maybe it's the people in the streets that we're going to collect that money from. When we do that, even those ones on the streets are going to be thinking, before I can support this, who in their mind, who is it that is? Those people outside don't think that they are the ones having obesity problems, even though we still have that. So from the political space, these are all the things that will go through the heads of anybody that is there, or the people that are there, and will lead to the kind of delays that we had of 10 years and all of that. And I think they are part of the things that we can always delve into, think about more. How do we achieve all of the aspects? Market issues. There will be people that have market interest because it's opening. We've talked about the industrialists themselves. And then when it comes to political capital, and then really think about the political window. Sometimes these tax issues get introduced by just executive fiats, but they happen when the environment is ripe and not when it is charged. Thank you.
Okay, thank you very much, Professor Chima. I taking it up from the financial analysis that you mentioned in terms of who is affected, who is not affected. USAID LHS conducted a very, very good study on fiscal space analysis for the Vulnerable Group Fund, and they look at accruable revenue from health taxes as well. So, Dr. Bola, can you share the highlight of that fiscal space analysis? What are the key takeaways take away from that analysis, and how do we realize some of those recommendations?
All right, thank you so much, Dr. Gafar. And good afternoon, everyone. We appreciate DGI for this opportunity to share some insights from our work. Okay. We appreciate the opportunity to share some insights from our work. So the USAID LHSS program is funded by USAID, and our objective is to expand financial risk protection to reduce financial barriers and out-of-pocket payments. And we also aim to increase the efficiency and effectiveness of social health protection schemes, the pro-poor ones, like the Basic Healthcare Provision Fund and the state equity funds. And so you would know that NHI, National Health Insurance Authorities, are a major stakeholder in government. And about 2 years ago, we had a breakthrough in health financing when the NHIA Act of 2022 was passed that identified and, approved a vulnerable group fund that's supposed to cover 83 million Nigerians. And we do know that BACPF till date is covering less than 5% of the vulnerable population in Nigeria. We have less than 1.5 million people enrolled in BACPF with all the celebrations that we've had. And even with our best efforts in states like Nasarawa, where we have equity fund being paid from the state to the local government level, we have all the 13 LGAs paying equity fund on a monthly basis. We still have been able to cover barely 8% of the vulnerable population. And so it stands to reason that we must look elsewhere to mobilize resources in addition to BACPF and the state and LGA equity funds to cover more poor and vulnerable people. And so the Vulnerable Group Fund that was in the NHIA Act of 2022 is where we turn to. And the question we asked ourselves is, where will the money come from? The NHIA Act listed some potential sources like, social investment funds, social investment funds, air taxes, and all of that as where we can generate money from. And so we asked ourselves, can we look at the potential of each of these innovative financing mechanisms, as we call them, to actually provide the money we need to cover the 3 million Nigerians? And so we looked at things like special intervention funds. What do we have in Nigeria? But one thing that we looked at very critically is the issue of earmarked funds from health taxes. And so we contracted DGI Consult to help us look at the various innovative financial mechanisms under the health taxes. We looked at alcohol tax, tobacco tax, and sugar sweetened beverages. And what we found was that, and I'm sure we've all listened to the research team that also worked on a similar work under this another project that DGI is implementing, but that from tobacco alone, we could get over 50 billion naira if we allocate or earmark 50% of the funds to VGF, Vulnerable Group Fund. And for alcohol, over 100 billion naira. And for sugar sweetened beverages, 13 billion naira. And we looked at it in terms of lives covered. Remember, that's our goal, to cover more poor and vulnerable people. And we saw that if we could actually mobilize these resources and get, all the legislative framework we need to mark 50% of them to cover more poor people, we increase our coverage of poor people by almost 15%. And that means we'll move from coverage of 2.5% or less at present. Even if we increase BACPF to 2% of the Consolidated Revenue Fund, like the National Assembly wants to help us achieve, we'll move to just 5%. But if you add these health taxes to it, we'll move as far as 20% coverage for the poor and the vulnerable. But we do realize that it's not as simple as it sounds. Health taxes have been identified as a win-win for governments. And like a lot of the panelists have said today, that's actually one of the most cost-effective ways of curbing non-communicable diseases. It's based on research findings, one of the most cost-effective ways. Do you know how expensive it is to roll out preventive programs, health education, behavioral change, communication projects? But when you just increase the price a bit or significantly enough to reduce consumption, then we can achieve a lot. So that's why it is a win-win for the government. You curb public health illnesses and then you increase revenue. But studies have shown that when you let your populace know, based on National Assembly, discussion we just had now, why you are doing this. It is more practical and feasible to implement pro-health taxes. When people realize why you are doing it and you make your communication strategic and clear, they are more likely to be accepted by both the political class and general population. But the finding has been that in many countries, until they became wiser, including Nigeria, the increase in the tax or the tax being placed on these products are not enough to curb consumption. We've said it here already today, and that is the number one thing that Nigeria has to look at. And even for public health reasons, which should be the primary reason for health taxes, what we have right now as increase brought by taxes are not enough to discourage intake. And that must be handled by the National Assembly, just for public health reasons alone. Now, the additional benefit is the revenue, and then the next step is now to focus on how to get that revenue to be earmarked to health. Like we've said here today, right now, it's not earmarked to health. We do realize it's not as simple as it is. Some things like a three-step approach, we must show efficiency in our health financing. We must show accountability, and we must show a high absorptive capacity. One of the researchers was talking, during his presentation, and he said, the DG budget, Ministry of Finance, they've all told us that we don't have enough absorptive capacity in health. Is this really true? Or is it because of the releases, the patterns of release, or the cycle, public financial management cycle that we follow in Nigeria? It makes that the releases come towards the end of the year, when the year has almost run out. So we need to fix it end to end. It's not just a silver bullet kind of solution. It has to be fixed to increase our accountability, efficiency, absorptive capacity. And then we go up to the more low-hanging fruits of mobilizing funds from state governments, equity funds from local government areas, and then the health taxes would have demonstrated capacity and ability to utilize resources efficiently to get the results that we are looking for.
So thank you very much, Dr. Bola. I think this is very impressive. Now you have given us the evidence that from health taxes, we can even generate more revenue than the Basic Care Provision Fund as it is now. So, when I did, if my arithmetic is still good, we're talking about 170 something or 60 something billion accruable as at of the time you did and then thanks for the advice in terms of what we need to do. The money people keep telling us that we don't know how to spend money. Maybe they'll have to come and teach us how to spend money in the health sector. They keep saying when they give us money, we don't spend everything. We are still asking for more. When I asked a director in the ministry, he said, when I ask for money to buy a car and the car is 25 million naira and you give me 12 million naira, so am I supposed to buy the car? I just have to return the money at the end of the day because you not allow me to go and deposit this year and complete it for the year. So I think we need to continue to have this dialogue to see how to solve some of these problems that you have identified. So let's go to National Tobacco Alliance. You've learned a lot on this pushing for the tobacco legislation. We learned that you spent like 10 years in the National Assembly and you are not tired, you are still pushing until you are able to get it. Though what you got at the end of the day probably was not what you are looking for exactly. But what are the important lessons learned that could guide us going forward in terms of designing legal framework for other health taxes in Nigeria?
Okay, thank you. The lessons learned is to increase the partnership with the National Assembly. That's one. Because we talked about taking up to 10 years to get the act. Let's remember, it took Ministry of Health and partners another 4 years to get regulation. 10 years to get the act. 4 years to get just regulation to implement the act. And when we were celebrating that we got on the act, somehow, somewhere, there was an assertion that before Ministry of Health will implement this act, they have to come back to the National Assembly again. So it's like passing another act. That one took another 4 years, from 2015 to 2019. So Ministry of Health had an act, but they can't do anything because they needed regulation to enable them the act to function. And when we are following up the regulation, one honorable then chairman at a time, National Assembly got confused going to give this regulation. They now came up with what they call Delegated Legislation Committee. That committee headed by one honorable from Kaduna. I will not mention the name. I know one of them said that yes, that they started it. The reason that at times when you do a law, that the government agencies, they go to implement it way outside the acts in form of regulation, so that they inserted it so that they will still come back to them. But the question we ask, and that is where there is most of it that is pure in tobacco control. We've done some trainings. I've done some trainings outside Nigeria on industry monitoring. We know that as you are one step, there are two steps. The industry, there are two steps ahead of you. And we know that they inserted that. So now, because when we checked, our legal people checked that in Nigeria, that was the first law then that before you do regulation, you must come back. Other laws, the agency or MDA concerned will just go and develop regulation. But the tobacco control was, you must come back to us again. And we went to both the House of Rep to the Senate. So when you look at it, what we've learned is to have more collaboration, to make them to understand better that all these things we are saying is not for us, it's for all of us. Because we're talking about taxation. The question we are asking ourselves is that the taxation on tobacco, is it working when you're talking from the demand reduction side? Because it's not working based on our own findings. Looking at the demand reduction side, we know what Nigeria is today. This water now, if I ask most of us, it's possible this hotel is rated up to 1,000 naira. Last few months, we bought this water maybe around 100 naira. But tobacco products, even with the so-called taxation, is still what you can easily get with your 10 naira, 20 naira. Because the industry has a way to absorb the taxation. Why the main aim? We're not looking at it from government getting funding. We're looking at it from angle of demand reduction. The main aim is to make it to be a luxury product. Some people in Nigeria supply their loved ones in developed countries tobacco product to smoke. Because in Nigeria here is very cheap. Over there, when a Nigerian travel outside these shores, the first thing when they tell you price of this is $5, your mind will go to zone 4 first. What is the value of $5? Let me keep my money. We've heard some Nigerians that travel abroad. When they tell them the cost of cigarettes, they will say, when I go home, I continue smoking. Because in Nigeria here, somebody pushing Paro can get it. So what we are saying is to engage them more and to make them, thank you, my brother, the prof is here and he's coming from there. I will have more discussion with him to make them know that most of these things we are doing is we don't know. It's like he that lives in a glass house. You don't need to throw stones. When we're saying all these things, you don't know if it's your child. When we say let's make and call this, and you are thinking that these CSOs, they've come with their wahala. We don't know who will be installed. And we know that tobacco is a gateway to other hard drugs.
Absolutely.
So why can't we do it so that it will be out of reach of the younger ones?
Absolutely.
So I think for now, I stop there.
So thank you very
Thank you.
much. I think I like the way you are very passionate about it, and very important point around forming a very strong partnership. The good news is that we have a legislative network for universal coverage, which is a assemblage of lawmakers that to push universal coverage issue. Health tax is a universal coverage issue. We have a sector reform coalition, another coalition here that are willing to work with all of us. Like I said, the most important thing to form a broad-based coalition that bring other people to it so that I will push forward. So on this note, we'd like to take a few questions, comments, and contribution for our panelists, and some questions from the presentation we made earlier on, so that in the interest of time, we have one outstanding presentation from Olumide. I can see me just working. So can we quickly, can somebody coordinate? Can we raise up our hands if you're interested in asking question? Okay, only Chief Palapo is interested. Okay, I can see. Okay, Sylvester Palapo, and okay, I can see 4 hands. There's no woman that is interested in us. Okay, except Dr. Lol. So. Okay, I can see hands now. So let's take this side. Let's take the question. Please, let's go straight to the question quickly. to manage time. And if you want, you may direct to a specific panelist, or if you want the researchers to answer the question. Thank you.
Okay, thank you very much. In the first place, I found the presentation of research findings very educative. I listened with very rapt attention. I want us to also note that both the honorables, the senators, and those in the executive are also consumers of these so-called products, be it tobacco, be it alcohol, and even SSBs. And also remember that many of them do have shares in those companies. That is on one side. Secondly, when I listened to the presentation on, especially the aspect of methodology of that research, except if I didn't hear very well, I didn't hear that out of the 23 or 24 KIIs conducted, there was a focus group discussion for consumers. I think we should, because I heard Dr. Gafar mentioning that part of the reasons why we gathered here this afternoon is to actually strengthen the outcome of that research. I think it will go a long way if we begin to look at all these issues, even from the consumer lens, and make it our approach. Let's, apart from the health taxes, of course, it has its own many benefits, but apart from imposing health taxes, these consumers, let's have a consumer-centered approach. Let's conduct focus group discussions amongst them and hear them out, what they feel about health taxes. You'll be shocked at the responses you get. One thing I know is from O-level economics, which is very basic. Somebody mentioned it along the line, but in passing, the demand for such products, tobacco, alcohol, SSB, are actually inelastic. And what that implies is that if you like, increase the cost of beer, increase the cost of tobacco to any amount, it's other things that we have to suffer for it. The number of bottles of beer and the number of packets of cigarettes will remain. For instance, if you increase the bottle of Heineken, to use the example Dr. Gafar has been using, if you increase the rate, instead of me dropping the number of bottles I do every day, it is the amount of money I drop for module of rice that might have to suffer for it, so that I keep my bottles of beer on a daily basis.
Okay. I think that's from a personal experience perspective,
No,
right?
it's not even personal. It's just an analogy. You never know whether I take anything or not.
Dr. Kalako, that is taken. Thank you very much for
thank
this
you.
contribution that we allow. Thank you. Yeah. So other questions, please. Thank you. Okay, Dr. Sylvester. Okay, quick. Oh, okay.
Oh, sorry. Okay, good afternoon, colleagues. Hey, good to see you, Ma. Good afternoon. My name is Sylvester. A very quick one. So I think there are many wonderful things that we've said today. And by the way, thank you, DGI and others, for putting this together. So two things. The idea that health taxes will discourage consumption of these harmful products is right. The idea also that we can mobilize additional resources is spot on, because we've seen that in a number of countries. But I want to draw our attention to something that has happened in Nigeria, which I think we should be very wary of and put measures in place to guard against. Many years ago, when we were talking about the BATPF as an earmark, the thought at that time was that it would serve as additional funding. Sadly, research has shown us otherwise. Since when we've had the BATPF, it has not led to an increase in funding for the health sector. When you think about it, rather what we've seen is more of a replacement and fungibility. So now again, we're talking about earmarks for health taxes, which I think should be the way to go, by the way. Question then is, how exactly do we ensure that this again does not go the way of replacement, fungibility, you understand, such that it would be the additionality which we seek for? I think that would be an important conversation to be had so that the benefits can be realized.
So
Thank you.
thank you very much, Dr. Sylvester. Okay, the Diabetic Association of Nigeria, then we'll come to the young lady over there.
Thank you, Mr. Moderator. My name remains Comrade Ben Atenya, Diabetes Association of Nigeria. There's a particular stakeholder that has never surfaced or participated in what we are doing. I want to talk about the Advertisement Council of those who approve and regulate advertisement. I remember growing up, I was in love with smoking cigarette because of the way Benson and Hedges was being presented. The finest tobacco made in England and all of that. And at the end of it, the Federal Ministry of Health warns that tobacco smokers are liable to die young. At a point, there was a regulation that this adverts should cease to exist. And because of that, what the eye did not see, the mind to an extent will not worry about. The noodles and most of these products, when you see the adverts on television, they are irresistible. Children, adult, hungry man size, and all of that. Now, why is it not possible that as we are achieving gradually towards the SSB's tax, how is it not possible that there's also the regulation is also subsumed into whichever legislation that will guide the implementation, so that if they don't appear regularly in our television, in all of these advert posters or whatever, possibly people who don't see and they are not attracted on their own naturally will cease to be consuming this product excessively. Thank you.
Thank you. Okay, let's come to Dr. Lake will come back to you later. Let's take Thank you.
Good afternoon, ladies and gentlemen. Thank you so much for the presentations. I want to agree with what you said, sir. For now, to me, except there is a data, a research to let us know that if we increase this tax, there will be reduced consumption, I will not agree. Except to go to the streets to find out what exactly can we increase this to, and you won't be able to afford it. Many other things will suffer. The women will suffer, the children will suffer, healthcare will suffer, food will suffer, many other things will suffer until we have that data. Please, I want us to work on it. Thank you. Then the second thing I want to talk about is, we've been saying so many things, and I agree with you. But while we are talking about marking all of these taxes, I want us to talk about it from beginning to the end. Kind of once it comes, what do we do? Including efficiency and accountability. It is very important that we talk about that. Then the third thing I'll talk about is, I'm passionate about this disability group. I don't know, because when we talk about this, we're talking about two things. One, we want to reduce consumption. Two, we want to increase the tax. So if we want to reduce consumption, it means we must carry everybody along. So I can't see maybe the association of the deaf here. Somebody will do the sign language stuff and reach out to people we cannot see, we cannot hear, and all of that. Please, they are part of the group and they need to be included. Then lastly is that I've listened to the conversation, but I think we all here in this hall, we have the, I don't want to say power, right? Maybe another thing apart from power, to say that there are some specific solutions. I mean, specific now, not just let's collaborate, let's partner, this, we all know all of that. What are the specific things we want to do before we leave this place? Kind of like all of us are putting our heads together to say, this is the exact thing we want to do. That's what are the next steps? What's the way forward? So I think, thank you. Then lastly, it starts with me. Whatever we say here, it starts with every one of us. So it's not just about senators, government, and not. I am a government. She is the government. Everybody is the government. Thank you very much.
Thank you very much.
I acknowledge Professor Akonde. That's my mentor.
So Dr. Lekki,
Thank you. This has been a very good discussion. Let me start from the point of generating evidence. This discussion, this study has shown, has gotten a number of issues that are related to steps that were required to be taken. So building on the last speaker, we need to have like an agenda going forward now if we're going to make progress. And the agenda needs to be a bit modest and not to be too, expectant. We need to realize a few things. We cannot get much more revenue if there's no significant increase beyond the 10 naira or so as attached. And getting that significant increase is going to take a lot of doing. It's been mentioned that constitutionally, any money that is collected goes to the federation account, right? And so earmark is not in the constitution, but there's a way you can get around that. Remember, we did that in the National Health Act. You will not believe that the person who fought the National Health Act the most is the least expected person, was the former Minister of Finance, Dr. Ngozi Iweala. I mean, this is a friend of the health sector, all the way from the World Bank, and yet wrote a policy letter to Mr. President why the National Health Act should not be signed into law. Can you imagine that? It was a surprise to all of us. But we went back and found a way to issue a letter to Mr. President attacking each point in Dr. Ngozi Iweala's memo to Mr. President and building a coalition, including people of the Catholic Church, including David Mark, who was a senator at that time, or so on. So you need to build a coalition of people who are going to support this. You may go outside of the normal confine of your comfort zone to be able to deal with that. So if we follow the trajectory that we use, National Health Act, it's possible to address the issue of constitutionality of that is there. We also need to be looking at the windows. When do you launch this? This is why we need to be a bit more careful in facing the step that we need to take. Right now in Nigeria, nobody wants to hear about taxes. I mean, the economy is depressed. People are angry and hungry. So just the mere mention of additional tax for whatever purpose that is going to save their lives tomorrow or next tomorrow, it's not something that resonates very well. The economy won't take it. People don't want to hear about it. So we need to be looking at windows of opportunity. That they say a new government, but we're not waiting for a new government now before we act. We need to go and softly build the coalition, National Assembly, to make sure that we create that window of opportunity and use that window to begin to push some of this. You can see what happened with the case of the cyber tech, revenue. I mean, they thought it would go through. They were already calculating the money that will come from the banks, a small percentage. All of a sudden, it has been reversed because of the backlash going in. So we need to be careful and not suffer the same fate that will set us back 10 or 15 years from where we are right now. So what am I saying? We need to carefully craft the agenda, face the issue that we want to take, build coalition, undertake sensitivity among the key stakeholders like the National Assembly, as well as people in the society about the harmful effect of this. I think we need to really sit down and get the work done. I also ensure that the coalition is strong. Everybody and every organization that can play a role should be brought into the fold and they be part of this agenda going forward. Thank you.
Thank you very much, Dr. Lekki. Yeah. So Dr. Mabogunje, just close to next one to him. Sorry.
Can I be permitted to sit down, please? Okay,
Granted.
I'm just going to write on what he said, that we need to understand advocacy. That's key for me. He's telling us advocacy is a game of number. Tobacco, I was a bit involved, but you are doing it as individual. Gather more people. In this room, you have everybody. Don't let one person start going to National Assembly. I don't think all of us understand advocacy. We need to understand that word. Your message is a bit funny. Your message is that you want to reduce intake. What's my business? If you want to continue taking it. I would think about that message to improve the health, not to reduce intake. Your message is wrong. So we have to redesign the message. You need to understand how National Assembly works. Professor Chika alone is not enough for this room. He has to go through many other people. So in essence, we are saying that you've started the right track of advocacy, working with everybody in this room, including others who are not in this room. We need to work with them and build a formidable force. Where your leg cannot reach, my leg will be able to reach there. And we spread our tentacles. Do you really want to take the 3 items? I think we should take one at a time. Tobacco may work, alcohol may work. Sugar, we should take it one at a time. So when we achieve success on one, we move to the other one, then the last one. But if you take 3 giants at a time, you would lose all. You must be careful in your advocacy and the steps you use for advocacy. If not, will be thrown back. So I wish us all good luck. But tobacco, you failed because you advocated. Most of you are medical doctors. I had the papers and I kept complaining. You need to be inclusive, not exclusive. It may be me you are excluding that may be against you. Have a good day.
Thank you. Thank you very much. So let's take a couple of contribution more from this side and we close. Okay. Yeah, thank you.
Okay, thank you very much. Let me start on the system protocol.
Yes.
Yeah, I think most of the issues I wanted to address, Dr. Lekki said it. The issue of timing is very important. Timing, because I'm looking at Nigeria now, see that the citizens are under suffocation with tax, and everybody is angry. So coming up with another tax, and if you remember in the morning when I was talking about my expectation, there are already multiple taxes in most of these beverages we have itemized. And this has led to most of the companies collapsing. Just between last year and this year, almost 8, big companies in Nigeria have existed, if you are reading it. And what are the consequences? Many Nigerians are thrown out of work. Criminality increases. Cyber crime increases, because that is the next alternative if you are thrown out of work. So why we are, following a coalition for this, we have to be very, very careful. Because I remember when this issue came first, and for the health sector, I wrote the concept note, which one of the advisors used to present to the Honorable President. Yes. But the problem we have is we are always prone to comparing Nigeria with America. Do we think of the GDP of that country? Do we think of the take home? If a tax is raised for them here, they have enough and have alternatives. Absolutely. So we really have to be careful. It's good to have more money to health, but the survey has shown that all these taxes, none has been ascribed to health. How are we going to get this one now into health?
Okay, thank you very much.
So just one more. The basic health care fund we have, what impact have we received from it? So these are things we have to think, and the time, the implementation, when Nigerians are relieved of the taxes. Thank you so much.
Okay, thank you. We take only 2 more in the interest of time. Okay, 3, one at the back, just to there. Quickly, please. Let's be brief here.
Yeah, let me thank the panelists for this very important discussion. For me, I think it's important to situate these questions as to what is the focus of the advocacy. Is it about reducing consumption? Is it about increasing revenue? Or is it about reducing the effects of malnutrition? I'm coming from nutrition perspectives. Now, you and I were there in DC to listen to what happened in other countries who have also implemented these taxation policies. And we understood that they took it step by step, which means incremental reductions or increase in the taxes. But I think the fundamental question for Nigeria is are we taxing well and applying the tax revenues appropriately? So if we want to move forward, I would think that first, we should advocate that the tax revenue should go to health, to address the health inequalities. Then we would also advocate for incremental, gradual tax regime, which means there will be a process. We could target a particular percentage tax increase over a period of time, but it has to be something that will be very defined and supported with science. But I think if we don't address it the way, it will become easier for someone like my brother, Professor Choma, to carry along and convince the policymakers. Implementing this process may still be difficult, even when you have been able to identify where you want to take it. That's my own.
Then thanks for that contribution. Then you and the last one from Sarity.
Good afternoon, everyone. Chuku Kenneth Obina, still my name. We impose taxes on these products that are harmful to our health. But my question is, are there policies or sanctions to those people that promote these products? Just like one of us said, the way he saw people that smokes while he was growing up, want to entice him to do so. These people that, the media house, like let me say the television station that promotes this product, are they sanctioned attached to it? Because if you notice, the radio sector, whenever they're playing a secular music and there's a word being used by the singer, it's always muted. So I don't know, is there any sanction attached to those that promote this product? Thank you.
Okay, thank you. And the last one from Sarity quickly.
Okay, good afternoon, everyone. I had to rush down from the office. I've been following up virtually. I want to commend you again for this topical policy dialogue. So just to add to what has been said, of course, there's the fear of blowback because of the timing. The economy is, it's not in good shape. A lot of taxes and all that. But despite that, I think the focus of this conversation is around health. And if that is the case, we have to, be very, very concerned about the consequence of tobacco, SSB, and all that, irrespective of whether it's taxes. Somebody said earlier that what is the objective? I think the objective is to kind of serve as deterrence, not actually for revenue collection and all that. Recently, about a week ago, I analyzed a bill sponsored by one honorable member from the National Assembly, objective to amend the National Tobacco Act of 2015, which objective also in line with what we are doing. And so just to add to the conversation, that we need to tighten the bet on how do we, ensure the population health by way of, regulations and all that. Because the cost to us, to health is more. Tobacco smoking alone claim 30,000 a year, according to the Global Adult Tobacco Survey conducted in 2012. That's another issue again. Since 2012, there have not been anyone that is being conducted. But from that data, 30,000 Nigerians die yearly, far more than what coronavirus claimed in 3 years. About 3,000 deaths were recorded. But tobacco kills 30,000 Nigerians, in addition to the cost of treatment and all that. So that is a very, very area of concern for us in the health policy space. Thank you.
So thank you very much, Sarity. I think the number of questions that are interesting contributing shows that people actually follow the conversation, and this is a very topical thing that we are discussing. So later on, I'll hand over to panelists to respond to some of these questions and give us final words. But before I do that, if you look at our agenda, Dr. Olumide Okunla from the World Bank was supposed to make a presentation, but he's going to summarize his key message to us now before we close that. And I'm very happy that we have Chief Mojima Kanjola and Dr. Iberi from the FCDO. So let's quickly hear, can somebody give Olumide microphone, please?
Look, thank you very much, Dr. Alawade, and apologies for coming late. Sadly, we'll not be able to make a presentation, but I'll just very quickly, in 2 or 3 minutes, just summarize a few points. I think the first point is, look, my team working with Gatefield, Nigeria Health Watch, 3-4 years ago, when we started this journey of pro-health taxes, and we were successful. Nigeria introduced sugar taxes on sugar-sweetened beverages for the first time. It was meant to be the first year, which will then be increased year on year. It has not been increased since then. But we were meant to build on that. So we're not starting afresh. This is a journey that has started with some success, albeit tepid. A second point to note is, I need not ask, but if you know anyone who is hypertensive, who is diabetic, the cost of that person's medication has quadrupled in the last 1 year. All right? Meaning that for those who are hypertensive, diabetic, you're beginning to see more of people going into chronic kidney shutdown. Yeah. People cannot afford dialysis. Look, the story is long. There's a need to begin to engage Nigeria Diabetic Association, hypertensive, and those are the kind of data that will move this system. Government is currently trying to see how they can reduce the cost of drugs. That's a good thing to do, but is it not easier to stop this from happening? So the way we also tell our story, I think we need to sharpen it a bit. And we were, it was a good thing that we had advocacy experts within Gatefield at the time who supported that agenda. So, because the way you write this story needs to be very specific. But I'll come back to that story bit. A third thing I'd like people here to mention is there's an epidemic which has even gone far beyond NCDs. So you have gaming or betting, which is actually also leading to increase in mental health, depression. And in fact, there's a whole lot of things coming out of that has a major implication for the health sector. And we need to include it in our narrative of pro-health taxes. So perhaps we need to expand this definition of pro-health taxes. I will not take the approach of balkanizing alcohol, sugar, betting, tobacco. You probably want to take it as a whole, because when the window of opportunity to increase comes, and moreover, the amount of financing they contribute to the revenue actually varies. But again, these are things that we need to have a nuanced understanding about. Just within that concept of nuanced understanding, and I would leave that for your FIRS colleague to mention to us, is how is Nigeria even proceeding with its taxation of these products? Ad valorem or specific taxes? So for a country that does not have the necessary technological capacity and the level of formalization of the economy, is ad valorem really the best way to go? Should it not consider more of specific taxes, or at best a mixture of both? And so just to say, something to consider, and it will be useful for the FIRS colleague to weigh in on that. It's also important that we situate our argument on solid ground. Pro-health taxes are first and foremost good for your revenue. We want revenue. We want domestic resources to be expanded. And right now, the level of mobilization of revenues that can come from this is so abysmally low that it is an opportunity for government to improve its fiscal situation. Where do we come in? We don't trust our government. Because if you bring in a tax, we don't know what you're going to do with it. However, Ghana introduced VAT and said, look, VAT, a portion of it is going to go into health insurance. You cannot take the Ghanaian health insurance away. So bringing in the health conversation into the introduction of some of these taxes softens the ground for the population, because then they can link that tax to what you are providing for them. But we also need to be mindful of the arguments on the other side. Economists and people working in finance and the treasury do not like earmarking because it is inefficient. Somebody mentioned BHCPF. As I speak to you, states have 30 billion naira that they have not spent from BHCPF. If we go to UBEC, as at last year, almost 100 billion sitting in the CBN. So earmarking people see as a bad idea. So they have a point to the extent that you said, look, perhaps, and again, it's something that maybe for some of us academics in the room to see what will work best for Nigeria. I think a last point for me would be, and we saw that when we were pushing on the sugar sweetened beverages tax. The budget for advocacy by Coca-Cola is in the region of billions. Or like someone mentioned, for Benson and Hedges or British American Tobacco, these are giants. And it's really hard to take them on. So we need to be a bit more deliberate, be a bit more intentional in our advocacy messages. Just to also say that one of the biggest points that the industry will raise is that it takes away jobs. This is not true. It is completely false. And we need to also put it on the table. Last comment, sir, is that it is the poor who benefit the most from the introduction of all of these taxes. A poor man who takes a bottle of Coca-Cola, that does not add a single ounce of nutritional value to that person, rather sets this person up for a lifetime of misery. Same thing with tobacco and alcohol. So in actual fact, if you increase those taxes, you are actually supporting efforts to take those people out of poverty. And in fact, that really is the premise of why we're having this discussion. Thank you very much.
Thank you very much, Olumide, for the summary. That very, very wonderful and very insightful summary. So because our time is fast spent, I'll ask the panelists to quickly give us their, maybe they'll to respond to any specific question and give us their last words. So let's start from FRS. Who is a convert now?
Yeah, thank you very much. Let me quickly respond to the question of the last speaker about how the SI's taxes is being administered in Nigeria. It's a mixed approach, the valorem and specific. So we have to also have it classified. The SSB, we have the class of alcohol, even also class of alcohol, beer and stout, spirit as its own class, tobacco as its own class. So we also have different ad valorem rate and specific rate that are attached, to these several classes. So that's how it's done. It's a mix of both specific and ad valorem. My closing thought on this discussion, is that there is need for a national emergency on this issue. That's one. Number two is that the policy objective should be very clear. And the message also should be very clear, because there is actually a lot of, policy objectives of several stakeholders. For instance, the Ministry of Finance, the objective is to raise revenue. The Ministry of Trade, the objective is to grow industries. The Health Ministry is for us to address the issue of health issues. The advocacy and stakeholders are saying, okay, but there's need for empirical data, evidence, data-driven policy. So if you have data that's okay, this is the issue we are facing. Nigeria currently ranked 147 out of 163 countries in the world in sugar consumption. Some policymakers say, oh, Nigeria is still far below. But if you come up with your empirical data and say, okay, these are the effect. You have number of people with obesity, number of people with diabetics, the issue of cancer. So if you come up with data and your message is clear.
Thank you. Thank you very much.
The lastly too, I want to also state that the issue of mass taxes is no longer fashionable using the national tax policy. So what the fiscal policy and tax reform committee is trying to do is trying to introduce what they call a special tax, where all taxes are put together. So then also, I also advocate for a gradual approach. So don't take them one at a time and ensure that the government understand your message with data, and also ensure that all stakeholders, ministry agencies, and all, including manufacturing industries, are also brought to the table so that you understand your message with data, and also there is this policy harmonization. So everyone has his own objective. So then let's begin to rank which one should take the first lead. Thank you very much.
Thank you very much. That's highly appreciated. Tobacco Alliance.
Okay.
1 minute.
All right. Thank you to say that. One of the things from what my mommy here said, I think that we need to do more is to more refine our messaging. But one thing I would say here is that you are looking for 80% of something and you got 50% cannot be seen as a failure. We're only talking about improvement. So to say that the tobacco people did not fail, Ministry of Health that led it did not fail, but what we are talking is that there's room for improvement. Once we are living, even if you get 100%, you can still improve on that 100%. So that's what I'm saying. That cannot be equated to be. Somebody talks about advertisement. I know that in the Act and Regulation, that's what we call TAPS, Act Advertising, Promotion and Sponsorship. And if you look at it today, hardly will you see or hear anywhere that tobacco is being advertised openly. We know that they are doing it subtly within the digital media. But if you have such, the agencies of government are already there. And above all, I think collaboration. There's a brother that talked about an honorable he stepped out. We would like to have a discussion with him about an honorable trying to amend the 2015 National Tobacco Control Act. And that this may be an opportunity for us now to key in to see how we can get all those wins that we thought we would have gotten. Above all, collaboration, collaboration, collaboration.
Thank you very much. Mr. Yakubu, last word from you.
Okay, I'm sure not so much questions for me. From basically, I took them as comments. But let me just point out that the Federal Ministry of Health is one ministry that we would all agree is grossly underfunded. If you look at it from the Abuja Declaration, which specifies that countries are supposed to earmark at least 15% of the annual budget for to health sector, you would agree with me that the Federal Ministry of Health is grossly underfunded. And so to say that, you know, the ministry is returning funds or monies budgeted for work at the ministry is a misrepresentation of facts. And thank you very much, Mr. Gafar, Dr. Gafar, for pointing out that some of these monies, you need to be very specific speak, what was it earmarked for? What was it budgeted for? And is the money even sufficient for that purpose? Were there mechanisms for actually utilizing these funds? We have instances where some monies have been allocated to the ministry, and as a matter of fact, how to even go about spending the money is a huge challenge because of bureaucratic bottlenecks. And so I just want to point out that, look, the ministry is very much reliant on partners for so many of its budget, so many of its programs, and so we are not funded enough. Just want to point out that the Ministry of Health still remains a converging point for partners, in health, for other organizations. Let's form a coalition, and the Ministry of Health through the Minister of Health, who has embarked on unlocking the healthcare value chain. We would put our heads together. Whatever we agree, we can leverage his cloud and advance that that advocacy agenda, with the National Assembly and with the executive, and we will get a lot done in the area of tax policies on these healthcare products. That we are talking about. So we call on this coalition to form a very strong group, and let's discuss and agree on issues. And then the ministry is very happy to advance the agenda. Thank you very much.
Okay, thank you, Prof.
Okay, thank you very much. Very robust conversations. I think I'll say key things like tobacco, people, the society, generally, there's a general agreement, there's a problem with it. Other aspects, sugar-based beverages, we still need to do more to make the citizens to see the challenge with it. That needs to happen. Is doing such things that will make it easier for the political actors to take the steps that they need to take. If they feel that citizens are going to lose capital, they would be conservative in the way they support those things. So we need to raise a lot of that, clearly, to make the citizens, for it to become a citizen movement. It's always easier to make things to happen, following on that. And then while we're doing all that, it will also be great to think about what the next thing is. I remember, Dr. Lekki mentioned some things about the National Health Act. And I remember then that one of the things that the Dr. Kunjiwala's team kept asking about was, if this is signed today, what will you do tomorrow? And it's, we ended up having nearly over 7 years before money started out, in private terms. They kept asking that question. And I think that question is important. And it's the kind of thing that we'll also be thinking about here. I mean, finance people will always interrogate such things. What will we do next? The 10 naira that was there, if there was better preparation in terms of what to do next, whatever things that we look at, what will happen next? Otherwise, a policy gets in, losers, there are people that win and lose. Those that will benefit from it may not be those who are winning and losing at that time. Somebody might lose today, a political person, and it will take 10 years for those who are going to benefit from it to start getting the benefits. Somebody has lost. And those things are important when we are thinking about the political considerations and what specific steps people may be willing or not willing to take. Thank you.
All right, thank you so much to all the contributors for the questions. Just yesterday, I stood at the window in my house and I saw a young man who works as a handyman, a truck pusher, so to speak, in my estate, smoking cigarettes. That was the first time I know. I've known him for almost 2 years, and that was the first time I noticed he smoked. So BAC, I'm sure he's poor and vulnerable, and BACPF has not reached him, but somehow tobacco has. I felt like jumping out of the door and calling him to order. But I told myself I'll need to calm down and look for the arguments, make the case to him. And that is the same thing that is applicable to what we are discussing today, making an investment case for pro-health taxes. Olumide spoke about the why earmarking is unattractive to policymakers, including people like FIRS and Ministry of Finance, the rigidity, the inefficiencies. And so that is why evidence has suggested that we instead use soft earmarking, that is more acceptable. So it's a range, it's a spectrum from soft earmarking to hard earmarking. Hard is when it is rigid, it is not subject to budget processes, not subject to political discourse, it's just going there straight, and there could be several of them that makes the process look inefficient. When it is soft, that means you are earmarking, but it is still subject to the budget processes. That means the policymakers, the financial authorities can still look at it and say, can we move this around a bit if there's evidence that this is accumulating too much? And they do it in Ghana. Well, not that the earmarking is flexible, but sometimes the health insurance authority in Ghana actually funds some health, activities, because they have so much money. They tell them, can you fund this? So they fund the Ministry of Health sometimes. So we need to move away from hard earmarking to soft earmarking that is more acceptable. And coming to the issue of investment case, the National Assembly is our ally. I've heard of how the chairman of the Senate Committee on Health asked for this analysis, asked for evidence. And so we must make, number one, a social investment case where we let the policymakers and the authorities see how using health taxes, for example, to cover more poor and vulnerable people on health insurance can improve and strengthen the social contract between the government and the people, showing that they are looking out for the poor people, and how we can make a political investment case of how fulfilling the presidential commitment of covering more poor people or Nigerians generally with health insurance can be moved forward by using health taxes to cover the people. As at now, nobody has answered the question of where the money will come from. But if we use health taxes, the political class can see how this can advance their cause. And then thirdly, an economic case of how we can have more fiscal space for health if we convert a disadvantage to an advantage that can bring health benefits for Nigerians. Thank you very much.
So thank you very much, Dr. Bola. That is highly appreciated. I want to know whether Daniel Bloom is still there from DC.
I am. Can you hear me?
Okay, we can hear you. Daniel, you have 1 minute to give us your last thoughts, please.
Thank you. I'll just make 3 quick points. One is on health taxes and their impact. So the consumption impact of health taxes and the revenue impact of health taxes don't have to be at odds. You can still have declines in consumption when you put in place well-designed health taxes, as well as gains in revenue due to the elasticities. So the first entry point should be really advocating for good health tax design. Second, we're pragmatic about the use of earmarking. I want to allude to the very good point that was just made about soft earmarking. Soft earmarking is usually more acceptable, but where earmarking is not acceptable at all to the government, where the Ministry of Finance does not see earmarking as an option, we have seen in our studies, so there's 75 countries that earmark, that there are countries that use options even outside of soft earmarking to direct revenue towards the health sector. And this is in the form of commitments. And I can share more information about this at a later point. But for instance, Hungary implemented a complementary commitment to the health sector where they increased health worker wages over 20%. Over a 3-year period without an earmark. So there's ways to do it without earmarking. My last point is that earmarking doesn't always net more revenue for the health sector. Even the very good case of Ghana, that earmarking has led to a net decrease in revenue over time since it's been put in place to the health sector. So it hasn't added overall to the amount of revenue for the health sector. The colleague was right. There's 10% release valve that also is within the NHIA where they can reallocate money. So there's some flexibility, but we see that having earmarks in place doesn't always protect the health sector. So I think that's an important point to keep in mind. Thanks very much.
Great. Thank you very much, Daniel. We appreciate those are very, very important points as well. I think you've agreed with me that This has been very, very, very productive 1 hour or thereabouts that we have spent discussing the issue of health taxes. And before we close this panel, let's realize that a number of recommendations that we've profiled in terms of having a coalition, generating evidence, doing advocacy, most of them require resources to do. So on this note, somebody was supposed to be on this panel to, in fact, to address how the donor community can support. Of course, a lot is being done, but for us to do more, to have a broad-based coalition. So we have Dr. Ebere Chukwu, who is the head advisor of the FCDO. So I'll give him the floor to speak for a couple of minutes on how donor community wants to support these lofty ideas in terms of what we need to do next. Dr. Ebere, over to you, sir. Can somebody give the mic to Dr. Ebere, please?
Okay. Thank you very much. Okay. Yeah, thank you. Yeah, so in terms of what the donors can do to help, it's essentially most of what we've been doing already, which is trying to support, the actual analysis and of health taxes, what is possible with using health taxes, and what impact they can have, on the fiscal space for health. But I think health taxes is fundamentally a political thing. It's a political decision because politicians must make decisions about the benefits as well as the costs. And in that, while we can help by supporting advocacy around it, but the actual decision-making has to be taken by the politician because they have to weigh the different groups. Because while we are here in this room, looking at it from our perspective, some other people might be somewhere else in a different room, looking at it from a very different perspective about why these taxes are not good for business and all of that. And a politician has to look at both interests and look at what is in the best interest of the society as a whole. So in that, for me, I think one of the key things that we need to do is to be really clear. So those of us who are supporting this initiative need to be really clear about the benefits, because the main thing about politics, at the end of the day, it's about the citizens, it's about the people. And we have to be very clear to the citizens what exactly is the benefit they're going to get out of this. So if there's going to be a tax on this or that or this, what does it translate to me tomorrow? Does it mean that if my wife is pregnant and she needs a cesarean section, she'll be able to go to the general hospital and get it paid for? If that's the benefit, really clear benefit, then it's easier for the citizens to understand. And then it's easier for the politicians because those citizens are votes, it's easier for the politicians to also understand. So I think bringing this down to the general public and helping them to understand this, the costs and the benefits, makes it easier for the politicians to make those, decisions. And I think that for us as donor partners, while we can provide the technical support, a lot of that, actual advocacy will have to come from the people and the health sector in Nigeria more generally. Thanks.
Okay, thank you very much. So I think We appreciate Dr. Berry for that additional input. So if I have to even summarize the conversation here today, it will translate to another presentation. But to me, one of the most important takeaways is that this kind of movement conversation shouldn't be a one-off thing. We should have a robust coalition that brings everybody together. Everybody that has a role to play is very, very important. Part of what I'm hearing, we have to be very clear about our objectives. What do we really want to achieve, and communicate in such a way that the people that needs to hear, we understand, and act based on it. Part of what I'm hearing is that, of course, we should be sensitive to the situation and environment, but at the same time, look for way around in such a way that the issue of taxation, and probably will communicate more from the health perspective than from the revenue perspective. In as much as we knew the revenue, let's as much as possible to be very clear to people that know that how it affects them as a policymaker and as everybody as well. And again, maybe we should probably play more a gradual approach. If you know the tax that is effective is 200 naira per liter, and might be willing to compromise and say, let's start with 50 or 80. And as time goes by, we make a more progress. And again, we should have to do more so that people, the ordinary people as well, can relate to what we are doing as much as possible. But the last thing I would like to do, somebody said, maybe there is no evidence that if you introduce a tax, it has implication on consumption. There is a last slide I want my colleague to quickly show. It's from South Africa. South Africa is Africa. It shows what was the consumption of cigarette. Can somebody put it up there quickly? It shows what was the consumption. Those bars that you are seeing is actually, so something is representing consumption, and then something is representing tax that's been applied. So what it shows that those bars are different types of taxes. And then that line you see is the consumption. So when the tax was very low, as you vary the taxation, when the tax became low, the consumption went up. Can you see that line? What you see underneath are those bars, the taxes. The taxes went down, the consumption goes up. And then when they increases the taxes, the consumption came down as well. They were able to do this because they have the data. And that is where we want to get into in Nigeria, where we'll be able to demonstrate. And they've been implementing it for a long time. So for Dr. Kolapo and others that feels that if there is tax on alcohol, they will not pay school fees again, then they will buy more bottles. It doesn't work well for the general population, like that for the general population. And there is evidence like that for alcohol, evidence like that for sugar sweetened beverages as well. Let's get there to generate evidence. So we have really done well and contributed very well there. Please, I want to encourage us, the Gatesfield and National Action on Sugar Reduction, they have like just 30-minute section to take us through what we are doing to enact sugar sweetened beverage law. Please, I encourage us to participate, and by 3 o'clock or thereabouts or quarter after we are done. So on behalf of the DGI team and the Alliance for Health Policy and System Research, I would like to thank you all for participating very well, listening to the presentation, making useful contribution, and listening to the panel discussion and providing feedback as well. I think to me, the greatest takeaway is that we are going to build a formidable coalition so that it doesn't stop here. We'll continue to engage, and then in terms of next step, all your contribution, we are going to incorporate them in the report that we're going to submit, and then we'll look for a way of engaging this type of group again, so that we have clear next step for each of the product. The good news now is that we're having a convert, like the Federal Inland Revenue Service is a convert now. We are, of course, very soon we are going to get the Ministry of Finance. We invited Nigerian Customs Service. I'm very sure in the next meeting they will be part of this section. So thank you very much. So by the power conferred on me, I hereby disband this panel. Thank you. I don't know whether Daniel is able to join from DC. encourage our elders to come and join us. Anyway, we have